Morning, everyone. Thanks for joining us for today's webinar. If you can just type in the chat box where you're joining from, that would be nice. Um, I'll go ahead and begin right away. Good morning, everyone, once again, and thanks for joining today's webinar titled Healthy Weight Gain During Pregnancy. That will be presented by Sarah Duke. Just before we start, I would like to acknowledge where I'm speaking to you from. I'm situated in Saskatchewan here in Treaty 6 territory, the traditional homeland and territory of the Cree people and the homeland of the Métis Nation. I want to pay respects to the First Nation and Métis ancestors of this place and reaffirm the importance of connection and relationships. I commit to building relationships with Aboriginal peoples and extending the reach of our efforts in both policy and practice. So I just want to quickly talk about what we do at the Prevention Institute for the benefit of those that may be joining us for the first time and they're not really so conversant with what we do. Saskatchewan Prevention Institute is a provincial organization, nonprofit. Our mission is to reduce the occurrence of disabling conditions in children by providing evidence-based information to Saskatchewan service providers, families, and communities. Our overall action goal is healthy children. And we do this by way of primary prevention methods by training, developing resources, providing information according to current best evidence. And we believe that all children, regardless of their ability, have the right to the best physical, social, and emotional health possible. So we work in a variety of topic areas. This includes perinatal and infant health, which I am the coordinator of, sexual and reproductive health, FASD prevention, early childhood mental health, child injury prevention, child traffic safety, as well as parenting. So those are the topic areas that we are involved in. And then for the perinatal and infant health program, I am the coordinator for that program. Main focus is to provide evidence-based information and resources to healthcare and service providers in Saskatchewan, and also to increase the knowledge and awareness of the practitioners. And lastly, to provide accessible information on healthy pregnancies to parents and families. So basically, that's what the Perinatal and Infant Health Program is about. So today, we'll be focusing on healthy weight gain during pregnancy. I just want to quickly share part of why we're doing this webinar. We have a resource that is actually titled Healthy Weight Gain During Pregnancy. We've had it for a couple of years, but we just recently updated it. And with the input of healthcare providers in Saskatchewan, including Sarah Duke and our community, our group as well, the Dietitians with First Nations Working Group. So we had inputs from them. And we also made the updated version aligned to the new food guide that was updated in 2019. And some of the things you will also find in the new, this new resource or updated resource, pardon me, is that we've highlighted some important nutrients in pregnancy, especially for women living in Saskatchewan. And we also included weight tracking using the My Saskatchewan Pregnancy app, because this is an app that we created last year or 2 years ago for pregnant people in Saskatchewan. And we have a way to track a weight gain in pregnancy in that app. And so we've also highlighted that in this updated version. So those are just some of the things you will find in this updated resource. And I'm happy to let us know that it will be available in print, hopefully this November. And you can order to use with the prenatal women or people you work with. And saying that we will have free shipping for this resource if you're interested until December. So once it's available, I'll send out a communication to let everyone know that we have the resource available for order. And then you can let me know, and you will be eligible for free shipping if you are not able to pay until December. So That's just it, just a bit of intro about that. I guess just remember to use the Q&A box if you have any questions during the webinar, and we also have a post-webinar evaluation that we would like you to please complete at the end. So I'll just go ahead to introduce Sarah right away. So our speaker today is Sarah Duke. She's a registered dietitian with over 4 years experience working with First Nations communities across Saskatchewan. She graduated with a Bachelor of Science in Nutrition from the University of Saskatchewan in 2017. Sarah began her career as a community dietitian with the Five Hills Qu'Appelle Tribal Council in Fort Qu'Appelle, Saskatchewan. In 2019, she transitioned to the Saskatchewan Tribal Council, where she works until today. She has experience working with the Aboriginal Diabetes Initiative, ADI, and the Canadian Prenatal Nutrition Program, that's the CPNP, to help promote health and wellness in First Nations communities. She's also the chair of the Dietitians Working with First Nations Working Group, which gives dietitians across Saskatchewan an opportunity to better support communities. So join me today to welcome Sarah as she takes us to today's presentation. So I'll just stop sharing right away.
Right, thank you so much. I'm gonna share my screen here. Okay, can you see my presentation? Okay, so thank you for that introduction. So my name is Sarah Duke, and I am a community nutritionist with the Saskatchewan Tribal Council. And today I'll be talking about healthy weight gain during pregnancy. So I just want to thank the Saskatchewan Prevention Institute for letting me come here and speak today. So what I'll be covering in this presentation, I will be covering why weight gain during pregnancy is important. I'll be covering the weight gain recommendations during pregnancy. I'll be touching on some nutrition recommendations for pregnancy as well. I will also be covering some other factors that can impact weight gain during pregnancy. And then last, I'll talk about how to discuss weight gain with pregnant women. So first, why is weight gain during pregnancy important? So gaining the recommended amount of weight helps the mother to reduce her risk of developing gestational diabetes. It also helps reduce the risk of high blood pressure, so hypertension or preeclampsia. It can reduce the risk of some complications at birth, such as an emergency C-section, and it can help reduce the risk of a preterm birth. Gaining the recommended amount of weight will increase the chance that the baby will have a trauma-free birth. So that means no physical injury to the infant during the birthing process. They'll have an increased chance of having a healthy weight at birth. It's also been found that women who gain the appropriate amount of weight during pregnancy, that they'll have an easier experiencing initiating breastfeeding. And then also there's an increased chance of having increased health later in life. So if a baby is born that is larger for gestational age, or if a mother is diagnosed with gestational diabetes, the baby can actually be at an increased risk for developing type 2 diabetes in the future. So gaining their recommended amount of weight can help reduce these risks. And a healthy weight gain during pregnancy allows the baby to grow and be well nourished, which all moms want. It allows the women to meet their nutrition recommendations, which I'll go over, and to stay healthy throughout pregnancy. And then it also helps their bodies prepare for breastfeeding. So it's important to note that weight loss is never recommended during pregnancy. So even women who have a higher pre-pregnancy BMI or a body mass index should follow the weight gain recommendations. It's also not recommended to have women try to avoid weight gain. We want to be staying within those ranges, which I'll be discussing in a little bit. Women might also be a little bit hesitant to follow the weight gain recommendations. So they might be a little bit hesitant to gain weight. So in those cases, it's beneficial to discuss the benefits of the weight gain that I've just reviewed, and it can also be a great idea to refer them on to a dietitian to get some extra support. All right. So the recommendations for weight gain during pregnancy. Health Canada is currently using the United States Institute of Medicine recommendations from 2009. And so it has a range of weight gain recommendations based on a pre-pregnancy weight. So if possible, when working with pregnant moms, if you were able to get a weight before pregnancy, that would be the most ideal to find out how much weight they should be gaining throughout pregnancy. The current standard is to use the weight and height measurements to calculate the BMI, or the body mass index. And so currently, as a dietitian, I typically do not use a BMI in my clientele who are not pregnant because it's not a great indicator of health. However, this is the best tool that we have right now for figuring out how much weight should be gained throughout pregnancy. So if you can see at the bottom of the slide here, so the BMI, that body mass index, this is the calculation for that. So you would take that pre-pregnancy weight in kilograms and you would divide it by the height in meters squared. So that's how you're going to figure out that. In the absence of an accurate pre-pregnancy weight, so if you see a mom when she's already pregnant and wasn't sure how much she weighed before the pregnancy, you can use a woman's weight in the first trimester as an estimate for the best possible outcome. Just some factors to remember. So there are many things that can play into how much weight a woman can gain throughout her pregnancy. It's not just her diet and physical activity, but there's things including but not limited to their genetic characteristics, some underlying health issues, socioeconomic status, their cultural norms and beliefs, their access to safe and healthy foods, and their opportunities for physical activity and family and partner support. So all of these should be included kind of in your assessment with the client to figure out the best possible plan for them to succeed in their weight gain recommendations. So here we have, this is from the Institute of Medicine, those guidelines from 2009. So this is the chart from there. As you can see, we have the different BMI ranges. So less than 18.5, 18.5 to 24.9, 25 to 29.9, and then greater than or equal to 30. So after you do that pre-pregnancy BMI calculation, you'll figure out where your client may fit into this chart. And depending on that, you would use this to figure out how much weight that they gain. So as you can see, the lower the BMI, the greater we want them to be gaining weight throughout their pregnancy. Now, as health professionals, you may know that these BMIs also have some labels on them. So the less than 18.5 would be underweight, and then there's normal weight, overweight, and obese. While I'm working with clients, I do not like to use these terms because it could maybe add some stigma onto the client. So one great thing that I think the Saskatchewan Prevention Institute has done with their Healthy Weight Gain and Pregnancy booklet is they made this chart. It has the BMI for you as the practitioner, but it also has some photos of the body of a woman. So that way it doesn't have to be characterized as underweight, normal weight, overweight, or obese. They can just look at this picture and they can figure out what body did their, or what picture did their body most look like when they got pregnant. And that's how they can figure out how much weight that they can gain throughout their pregnancy. And usually most of the weight gain is going to happen in the second and third trimester. For the first trimester, it's a really slow weight gain. So maybe only 2 to 5 pounds will be gained then. And then once they hit that second and third trimester, we want to be seeing an increase in weight every single week. So 1 pound per week if they're in the first 2 BMI ranges, and then about half a pound per week if they're a bit higher. And so where does all of this weight gain go? This is a really good visual to show some of your clients who may be a bit more hesitant on gaining the recommended amount of weight. So this was taken from Health Canada, and it's just an example of a woman who was pregnant who ended up gaining 27 pounds, 4 ounces over the pregnancy and gave birth to a 7-pound, 4-ounce baby. So depending on your client, these weights may change, but it's just really great to show the woman like it's not just the baby that's adding the weight. They also need extra weight to support their placenta, amniotic fluid, their blood volume, uterus, additional water, their breasts for getting ready for breastfeeding, and additional fat stores. So it's not all just going to the baby. We want to make sure that the women understand why it's so important and where that weight is going and how it's going to help them have a healthy pregnancy. So some other considerations, you may find that you have had adolescent pregnant clients. And so adolescent pregnancies are usually at an increased risk for preterm delivery, a low birth weight, or a small for gestational age. And typically the BMI ranges that I showed before, those would not be used to consider or to assess the weight status of adolescents, but this is the best tool we have right now to determine the gestational weight gain goal for teen pregnancies, so you would still use that. If you're working with teenagers who are not pregnant, you wouldn't use those BMI ranges. When the client is younger than 16 years of age, you may want to estimate their weight gain goal towards the higher end of that recommended range, just to decrease that risk for preterm delivery, low birth weight, and small for gestational age. And if you are seeing a client who is in their teens, it would be a good idea to refer them on to a dietitian because we can make sure that they're meeting all of their nutritional needs as they differ a little bit from the adults. And another consideration is twin pregnancies or multiple babies. So when someone is carrying twins, they're also carrying more maternal tissues and a higher fetal weight. So therefore the recommendations are going to be higher for their weight gain. So unfortunately, there's insufficient evidence on developing guidelines for that underweight, so less than 18.5. However, we do have for the other BMI ranges here, the recommendations. There's also lot less evidence for women carrying 3 or more babies. So there aren't exact numbers for weight ranges for those moms. However, since we are gaining more weight from the single to the twins, you would assume that a woman carrying 3 or more babies would need to carry even more weight to help carry that maternal tissue and higher fetal weight. And again, it's always a great idea to refer these clients to a dietitian in order to help them meet their weight gain goal and meet their nutrition needs. So now we'll dive in a little bit into the nutrition recommendations throughout pregnancy. So this is the new Canada's Food Guide. It was developed in January of 2019. So for those of you who haven't seen this one before, we no longer have the food groups or the rainbow or the food guide servings. This is a lot less prescriptive. So I really like that we have this healthy plate now to have a visual of what people should be eating throughout their meals. So for pregnant women and honestly, the entire general public, we want everyone to enjoy half of their plate with plenty of vegetables and fruits, choosing whole grains more often so that they can get more fiber into their diet. There's also a push to be choosing more plant-based proteins more often, so things like lentils, beans, and peas. And the reason behind this is they're going to give us that protein we need. They're going to be really high in fiber, and they're also low in saturated fats, which are less healthy for our hearts, and drinking water most often. So all of these combined together are going to help pregnant women. They're going to get the nutrients they need. They're going to get the energy that they need, and it's going to help them support their healthy pregnancy. Now, this is another chart from the Saskatchewan Prevention Institute, the Healthy Weight Gain During Pregnancy booklet. So as you can see, there's no extra snack needed in the first trimester. Like I said, there's very little weight that's going to be added in the first trimester, so about 2 to 5 pounds. So typically women don't need an extra snack. However, there's a very common myth out there that when women get pregnant that they are eating for 2, so they believe that they need to eat twice as much. Now that isn't true. The truth is that pregnant women only need a small amount of extra food, typically starting in the second and third trimester, to support healthy weight gain since their baby is growing much faster. And so here you can see they can add an extra snack throughout their day, or they can add in a couple of extra portions in their meals to help support this healthy weight gain. It's also important to note that this would be if someone you are seeing is already meeting their nutrient needs. If they aren't eating enough calories or meeting their nutrition needs already, they would need more than that extra snack. And if a woman is maybe a bit more physically active and she needs that extra energy, we shouldn't be limiting to just one snack a day or one extra portion. We really want the pregnant women to be following their hunger cues, figuring out when they feel hungry, and eating nutritious snacks based on that. So when they are going for that snack or extra servings, we want them to be nutrient dense to help that healthy pregnancy. So things like veggies and dip, maybe some trail mix, yogurts and berries, eggs and toast, things like that. Now we'll go through a few of the nutrients that are important throughout pregnancy. So we have folate/folic acid here. For those who don't know the difference, so folate is just a term used for it found naturally in foods, and folic acid is what's found in supplements or fortified foods. So it's the same thing, just one is found naturally and one is supplemented. So folic acid is essential in the development of the spine, brain, and skull in the first 4 weeks of pregnancy. And so having enough of that nutrient in our body can help reduce the risk of neural tube defects, such as spina bifida. So because many pregnancies aren't planned, and the fact that this nutrient is so crucial in the first 4 weeks of pregnancy, it's actually recommended for all women of reproductive age to be taking a multivitamin containing 0.4 milligrams or 400 micrograms of folic acid every day. So that way we can help reduce those risks of neural tube defects, even if a pregnancy happens unplanned. If you are seeing a woman who is maybe thinking about getting pregnant, then it's best to start taking that multivitamin a minimum of 3 months before getting pregnant. So if you are seeing women maybe who are thinking about getting pregnant, definitely start telling them about this multivitamin ahead of time so that we can reduce those risks of neural tube defects. Now we can also get our folate from food sources. So you might see a trend in a lot of these foods. We get them from a lot of dark green vegetables. So things like asparagus, avocado, broccoli, Brussels sprouts, green peas and beans, and our leafy greens like lettuce, spinach, and kale. So a lot of those have higher folate amounts. Then there's also things like beets, eggs, oranges and orange juice, our plant-based proteins like those lentils, beans, and peas I talked about before. And then there are also some grains that are enriched with folate. So flour, pasta, cereal, bread have been supplemented with folic acid to help prevent those neural tube defects in the general public. And here we have the next one is iron. So iron is an essential component of the hemoglobin. And hemoglobin is a protein in our red blood cells that transports oxygen to the body's organs and tissues. Now, during pregnancy, a woman needs more iron to support the increased maternal red blood cell mass. There's also a process towards the end of pregnancy where a mother will give her baby 6 months worth of iron stores before the baby is born. And the reason behind that is because it's recommended to exclusively breastfeed for the first 6 months of life, but breast milk is not a good source of iron. So the mom is giving her baby iron stores to fill up those 6 months. And then once the baby starts eating solids at around 6 months of age, that's when we want to start those iron-rich foods. So that's another reason why it's so important for a mom to have proper iron levels. So it's recommended for pregnant women to eat iron-rich foods following the Canada's Food Guide and to take a multivitamin with 16 to 20 milligrams of iron every day. Now, it's important to note that all multivitamins are going to have different amounts of each nutrient. So whether it's a multivitamin or a prenatal that they're choosing, it's really important each time that they're checking the label to make sure that they're getting the proper amounts of each nutrient, because different brands can have different amounts of each nutrient. So our food sources of iron, that would include any meat, so our beef, pork, chicken, fish, or seafood, If you have a hunter in the family, some wild game, such as moose, elk, deer, and duck would be a good source of iron. We also get it from our plant-based proteins, and there are some grains also enriched with iron, such as cold cereals, oatmeal, and pasta. Now, for some clients, if you have them, if they're more of a vegetarian or eat more plant-based proteins, those plant-based proteins are not absorbed as well as the meat. And so we want to be pairing them with vitamin C rich foods because that actually helps increase the absorption in our body. So things like oranges, tomatoes, peppers, strawberries, broccoli, pair those with your lentils, beans, and peas, and you're going to have an increase in absorption for those foods. And last, calcium and vitamin D also work together to play a key role in promoting healthy bones and teeth. And during pregnancy, calcium and vitamin D are needed for the growth and development of the baby's skeletal tissue. However, calcium and vitamin D requirements do not increase during pregnancy. So the same amount would be recommended for the women before pregnancy and during pregnancy, but it's still a very, very important nutrients to help promote skeletal growth. So our food sources of those for our calcium would be cow's milk, cheese, yogurt, plant-based milk alternatives. So that would be things like fortified soy beverages, almond milk, oat milk, all those types of things. A lot of them now are fortified with calcium and vitamin D because they're not naturally rich with them. And we still want people who aren't able to drink cow's milk to be meeting those nutrient needs. And then fish with the bones crushed in. So the bones are what you're going to be getting that calcium from. So if you don't mind that, you can do that as well. For vitamin D, we would have fish such as herring, rainbow trout, and salmon. Again, there are some foods fortified with vitamin D, such as cow's milk, some yogurts, and those plant-based milk alternatives. And we can also get it from margarine and eggs. Okay. So what else can impact healthy weight gain? Obviously, we want to be promoting physical activity as well throughout our pregnancy. So the next few slides, I got this information from the Canadian Society for Exercise Physiology. And these are the 2019 Canadian guidelines for physical activity throughout pregnancy. So all women without contraindications should be physically active throughout pregnancy. So I would advise women to speak to their doctor, their nurse practitioner, their midwife, to ensure that there are no contraindications present so that they can safely exercise throughout their pregnancy. And physical activity is now seen as a critical part of healthy pregnancy. Following the guideline can reduce the risk of pregnancy-related illnesses, such as depression, by at least 25%, and the risk of developing gestational diabetes, high blood pressure, and preeclampsia by 40%. So as you can see, there are a great number of benefits from being physically active if there are no contraindications in the pregnancy. There's benefits for both mom and baby. So there would be fewer complications for the newborn if they're physically active. So they would have a reduced risk of being a large for gestational age baby. And then as previously stated, there are numerous health benefits for the mom, such as decreasing the risk of gestational diabetes or hypertension. And it's also going to help us help our clients to meet their weight gain goals and stay within those ranges of recommended weight gain. So it is recommended to accumulate at least 150 minutes of moderate intensity physical activity per week. So that's about 30 minutes 5 times a week. Things that are safe for most pregnant women to do would be walking, swimming, prenatal yoga, and even things such as housework or gardening could be considered a physical activity as well. We want to be making sure that they have a minimum of 3 days per week of physical activity. However, being active every day is encouraged. So the more that they can get active throughout the day, the better. When women have been previously inactive before their pregnancy, they may be a little bit hesitant to start being active throughout their pregnancy. But as long as they talk to their healthcare provider, there are no contraindications. There's no reason why they can't be physically active. They just might want to start at slower progressions. So instead of starting at 30 minutes a day, maybe they start at 10 minutes a day and slowly make their way up to that 30 minutes and then slowly increase to 150 minutes per week. We wouldn't want them to be pushing themselves or hurting themselves. So starting that slow progression is key. And a few other factors that can affect our weight gain is stress and sleep. So to help reduce mom's stress a bit, making sure she's practicing self-care, relying on her family and partner supports, and completing activities that help nourish the mind, body, and soul. And for sleep, we want to be getting at least 7 to 9 hours of good quality sleep on a regular basis and having about the same bedtime and wake up times each day for that consistency and having some good sleep hygiene. Now, this would be for adults. If you are working with adolescent pregnancies, they would need even more sleep than this. So all of those recommendations would be on their website there. And now how to discuss weight gain. So weight gain can sometimes be an uncomfortable topic to bring up, maybe as the practitioner, maybe for the pregnant mom. So these will be a few tips to help you discuss this weight gain in a positive manner. So I got this information from the Canadian Obesity Network. And so the Obesity Canada is the country's leading obesity registered charity association for health professionals, researchers, trainees, students, policymakers, and Canadians living with obesity. Their main goals are to address the social stigma associated with obesity, changing the way policymakers and health professionals approach obesity, and improving access to evidence-based prevention and treatment resources. So they have a lot of great resources on their website. If you've never been, they have the 5 A's of healthy pregnancy weight gain on there. So those 5 A's would include ask, assess, advise, agree, and assist. So for ask, first thing we want to do is we want to ask permission to discuss weight. We never know what a woman has experienced previously in her life or with other healthcare professionals. She might have had a negative experience, or maybe she's a bit less comfortable about speaking about weight. So it's always good to ask permission first. So example, just saying, could we discuss your thoughts and feelings regarding weight gain during pregnancy? Opening it up that way instead of just delving in and making potentially the mom a little bit uncomfortable. We also want to be non-judgmental and ask questions before making statements. So finding out how the women feel about weight gain and their beliefs about weight gain can sometimes make it easier to make statements that are going to be more helpful for the mom. And then we also want to explore the readiness for change. Now, a lot of women want to do a lot for their babies and stay as healthy as possible. So I find a lot of pregnant women are really ready to change. However, there could be some clients who are a little bit more hesitant. So we need to work a little bit slower and make sure that they realize the benefits of gaining the proper amounts of weight throughout their pregnancy. Then we want to assess. So if this is your first appointment with this client, you want to assess that pre-pregnancy BMI. So doing that calculation, figuring out what range of weight gain that they want to be in, and then making a plan to go towards that. So first we want to do that. If you were a practitioner who is typically weighing someone throughout their pregnancy, then you want to do that at every prenatal visit. However, if you're not someone who weighs them every time and you have access to their weights regularly, you don't necessarily have to weigh them every time, especially if a mom is a little bit less excited to get her weight gain or her weight taken at every prenatal visit. We want to be mindful of that. So as long as there's a practitioner always tracking the weight gain that you have access to, that would be great. We also want to assess any barriers that may affect weight gain. So some of the things that I talked about earlier, there's so many factors that can affect our weight gain, such as access to safe and healthy foods, having the opportunity to be physically active, having the socioeconomic status to be able to do all those things, having those supports from your family or your partners. So keeping in mind all of these barriers and trying to work with the women where they are and meeting goals that are achievable for them. And we also want to assess their pregnancy-related health beliefs. So there might be some women who come in and believe that they need to eat twice as much because they're eating for 2. They might believe that it's not healthy to gain so much weight throughout their pregnancy. So we want to be making sure that we're finding out those beliefs and letting them know what the evidence says about those. And advise. So discussing the importance of making a plan throughout the pregnancy. So if you get to see them really early on in their pregnancy, making that plan throughout so that they are gaining the appropriate amounts of weight, explaining those health benefits of a healthy lifestyle and the recommended weight gain, and then focusing on what your client wants from their management options. So if a woman doesn't want to focus on weight gain, and they just want you to take the weight and not really discuss it as much, that's okay. Maybe they want to focus on healthy eating more, or maybe they want to increase their physical activity or focus on their sleep or their mental health. All of these things can help a woman gain the recommended amounts of weight. So it doesn't always have to be a goal focused on that number, on that weight. It can be more goals focused on the behaviors around it. And then agree. We want to agree with a plan with our clients. So something that you and the client are both willing to work with. We want to make sure that the client is happy with that plan, because if they're not, they're probably not going to follow it, right? So you want to be making sure that they're attainable and sustainable behavior goals. If you haven't already talked about SMART goals before, we do this a lot with our clients, but we want them to be specific, measurable, achievable, relevant, and time-bound. So for a woman saying, I want to eat healthier, that's not a very SMART goal. We want to get more specific than that. So they say they want to eat healthier. Well, what do you mean? How do you want to eat healthier? Well, maybe you find out that they want to be including more vegetables and fruits in their diet. Perfect. Then you want it to be measurable. So how are you going to measure the success of that goal? If they want to increase their vegetables and fruits, then we're going to measure that by they're going to have vegetables and fruits make up half their plate for their supper 3 days a week. Perfect. We can measure that and see if they're achieving that. We want it to be achievable. So if someone, rarely eats vegetables or fruit, obviously we're not going to say you need to have vegetables and fruit with every single meal, every single day. That's not going to be very achievable for them. We want to start slow and work our way up towards the ultimate goal. We want to make sure it's relevant to their pregnancy to help them have that healthy pregnancy. And we also want it to be time bound. So with pregnancy, we usually have a bit of a timeline, but if you're making smaller goals, you might want to have a smaller time period than that 9 months. And then assist. So after we've made our plans and developed our goals, we want to assist our clients as best as possible to help meet those goals. So identify and address any drivers or barriers. There might be some that come up that include barriers. Maybe there's some successes along the way. We want to make sure we can address those. We want them to be maintaining their healthy behavior, so making sure that what we planned was achievable and that they can follow those. Also offering education and resources where needed. So there's lots of great resources that I'm going to talk about at the end of the presentation here that you could provide to the clients. And then refer to appropriate providers. So like a registered dietitian is myself. If they want to be eating healthier, you can definitely send a referral that way, or you could refer to an exercise therapist if maybe they're interested in incorporating more physical activity in their life. So make sure they have the opportunity to see as many providers as they're able to, and arrange for follow-up. So we want to be following up throughout that entire pregnancy and making sure that they're gaining that appropriate weight all the way through the 2nd and 3rd trimester until birth. Now, I mentioned referring off to a registered dietitian is great, but there are some instances where there should definitely be a registered dietitian involved in a pregnant woman's care. And those instances would include having a teenage pregnancy, so especially if they're less than 16 years of age, multiple babies, so twins, triplets, or more. If the mom has had previously low or high birth weight infants, if she has a low pre-pregnancy weight, so below that 18.5, that underweight category. Poor weight gain during the 2nd and 3rd trimester. So if they're not meeting those weight goals, we definitely want to be seeing them. They may have some nutrition-related health conditions along with their pregnancy. So some that could arise during their pregnancy, such as gestational diabetes or preeclampsia, you can definitely send a referral off. Or maybe they have a condition that they had before their their pregnancy. So inflammatory bowel disease, celiac disease, diabetes, all those types of things. Those are great to send a referral off to the dietitian as well. And iron deficiency anemia. Now, a few more reasons to refer to a dietitian. These aren't as pressing, I guess, but we would still like to see people if they're experiencing severe nausea or vomiting during their pregnancy, especially if that's hindering their ability to gain the appropriate amount of weight. Sometimes people have higher requirements for specific nutrients. If their weight gain has exceeded their recommended weight range, if they're at risk of a poor nutrient intake, they might have food allergies or intolerances that severely restrict some nutrient intake. So if that's the case, pass them on to us. Or if they have other restricted diet patterns, such as vegetarianism or veganism, those can also restrict some nutrients that are important during pregnancy. So we want to be making sure they're getting enough of those. And then if a client expresses interest, so even if a client doesn't have any of these different points, they could still be referred to us if they express interest, because not only can we see them during their pregnancy and make sure they have a healthy pregnancy, but then we can help support them, with breastfeeding after the baby's born, and then introducing solids at that 6 months, and continue following them and their child to ensure that they're both having a healthy life. And so here are some resources. I know this was already said before, but the Saskatchewan Prevention Institute really does have amazing resources on their website, including the My Saskatchewan Pregnancy app, which has that weight tracker. So if a woman is really interested in following her weight herself, she can track that throughout the pregnancy to make sure she's gaining the appropriate amounts. And then that healthy weight gain during pregnancy, I'm very excited for that update to come out, and so people can see those changes. There's also the Society of Obstetricians and Gynecologists of Canada. They have some great resources as well for some clients. And then this is more for you as practitioners, but Health Canada has a wealth of knowledge with lots of different aspects of pregnancy, and they also have a pregnancy weight gain calculator in their website that you can track along with. These are my references, and that's all that I have for you. So thanks so much, everyone, for joining, and I guess we'll open it up to questions.
Yeah, thank you so much, Sarah. That was really a very informative presentation. Yes, so we'll go ahead and take questions right now. If anyone has questions, please use the chat box and the Q&A box. I think we have one already. Someone says, Carlene, Miss Zara says, is there a multivitamin that you recommend?
There's not a specific brand that I recommend. I just always recommend those women looking at the label and making sure that it's the nutrients that they need. So typically a prenatal vitamin is going to have more nutrients that are specific towards pregnancy. However, if there's a multivitamin that they really like and they find that they enjoy and it still has those nutrients that they need, then they can definitely keep taking that. They just want to be checking that label every time, because even though it might look like the same vitamin, if it's just a different brand, it could have different amounts of those nutrients in there.
Yeah, absolutely. Thank you. I think I have a couple of questions as well. Seeing that pregnancy is a time women kind of are a bit averse to certain types of food, maybe things they usually used to enjoy, and then all of a sudden, because they're pregnant, they are not able to tolerate it and all that. And some of them may be very important, may contain very important nutrients that is really good for them. How would you advise service providers to kind of work with women that maybe have a lot of food aversions during their pregnancy?
Right. So that would be another great example of when to refer on to a dietitian, actually, because we can do a bit more of a diet history and find out what they're typically eating and what they can't handle as much. We can give them some tips and tricks on, maybe reducing their nausea or their aversions. But if it's something, if the aversions are really severely restricting their diet of a lot of the nutrients, then definitely I would pass a referral on to a dietitian.
Okay. Yeah. Thank you. Speaking of dietitians, just wondering how do clients, how can they get in touch with their dietitian within their community easily? Because I know that, you guys are a very great resource to the clients, but how can they easily access
Mhm.
dietitians?
Are you talking about dietitians in First Nations communities or just dietitians in Saskatchewan in general?
In general, in Saskatchewan,
In general.
whether in First Nations communities or
Uh,
even
So
elsewhere.
in First Nations communities, as the chair of the dietitians working with First Nations group, I do have a list of dietitians that are at each community. But the best way, honestly, if you don't know who that dietitian is, you can always just call their health center, and their health center is usually going to know who it is and can patch you through to that. For other dietitians, there are some private practice dietitians throughout that you could search for. But yeah, I guess if there's dietitians within the hospitals that you find could be helpful, you could definitely refer them on there as well.
Okay, thanks for that. I'll check if we still have any more. Okay, someone is asking, is the copy of this presentation available?
Yeah, so I can send that out to you if that's like to Timmy, and then she can provide that to everyone if that's something that people are interested in.
Yeah, sure. Great. See, there's another one. Okay. Megan says, I understand that people in Saskatchewan, particularly in northern Saskatchewan, tend to be low in vitamin D. Do you address this during pregnancy?
Yeah, so with pregnancy, yeah, we do want them to be getting adequate vitamin D. A lot of prenatals also have vitamin D in those multivitamins, so we can address it through that, and then also through their nutrient intake. Yeah, because unfortunately, since we live in Saskatchewan, not many people are getting enough vitamin D from sunlight exposure. So we want to be making sure that we're getting it through their diet or with their supplement.
Great. Thanks for that. I think we have another one. Debbie Vay says, we find lots of our clients have B12 deficiencies.
Oh, vitamin B12. Okay. Yeah, so vitamin B12 is typically found in animal byproducts. So our meats or anything that comes from an animal. So that's another reason why if a client is vegetarian or vegan, it would be important to refer them on to a dietitian so that they can meet those B12 needs, because they wouldn't be getting as many from their food.
And she's also saying, what are the good food sources for this? For B12?
Yeah, so any animal byproduct, so our meat, um, any types of meats or anything that comes from an animal, so like our dairy.
Okay. And if the person is vegan or vegetarian, then they might need supplements, right?
Yeah, so then that would be a good reason to refer on to a dietitian.
Okay. So, okay, I also have another question. For people who are unable to access like really healthy food, like milk and things like that, because they could be very expensive, especially in the north. Are there any kind of like support programs where they can be assisted or something to be able to access some of those kind of important kind of foods?
Right. And so I'm not as aware of what's happening in the health authority, but within First Nations communities, through our Canadian prenatal nutrition program, we do have like things like good food boxes for women where they can get produce or healthy foods at a lower cost. We do prenatal cooking classes where we teach cooking skills to women. We can do food vouchers to make sure that they're getting enough food from the grocery store. So giving them a bit of a food voucher for those healthier foods and things like that. So we do have quite a bit of programming for women who are pregnant in First Nation communities.
Okay, great. Thanks for sharing. I think we have another question. Julie Lawrence says, do you have a good resource for using language with anti-fat bias weight can be a trigger for women who have had negative experiences due to their weight.
Right. Yeah, that's a very important question and topic for sure. Unfortunately, I don't have one specific really good resource for anti-fat bias, but that Canadian Obesity Network that I discussed with those 5 A's, they have some good resources on how to discuss weight and how to have um, less stigma or bias towards people who are living in bigger bodies. So I would definitely refer you to that website to find out more.
Okay, thank you. I think I also had one while you were making your presentation. You had mentioned that women that develop gestational diabetes and maybe things like eclampsia and preeclampsia are like situations where you should refer. What about for women who have had gestational diabetes in their previous pregnancy? Would that be a requirement to kind of pay a bit more attention to that particular client or not?
Yeah, so if someone has had gestational diabetes in a pregnancy previously, they would be at an increased risk of developing it again. And so it's always a good idea to send a referral off to a dietitian to make sure that they're meeting those nutrient needs and kind of controlling their blood sugars earlier on in their pregnancy in the hopes to reduce that risk of developing it again.
Okay, great. Okay, let's see, thanks. Is any other questions? Okay, since there is none, but I'll chip in a bit, another one. So I realized that now in Saskatchewan, we have quite a very growing immigrant population of of women and people that are pregnant or of reproductive age as well. I don't know if there's any way maybe dietitians are working to be able to improve communicating, educating this kind of population, especially because some of their foods might be quite different from what we eat here in Canada already, and how to work with such clients, basically.
Yeah, that's definitely really important for those clients. Unfortunately, in my career, I don't see that clientele, so I'm not 100% sure what all is being done to ensure that they're getting the proper care. But I hope that the dietitians in the health authority seeing these clients would have those types of that type of information and be able to support them properly, because that's a really big thing with a dietitian. We want to treat every individual where they are, and we want to make sure that they're eating the foods that they enjoy and that are culturally appropriate to them and that they can access those foods. So hopefully those dietitians in the health authority are working with that population and doing a good job.
Okay, I think that's about it. Yeah, thank you so much, Sarah, once again for a great presentation. That was quite enlightening. And thanks for also supporting our Healthy Weight Gain booklet, the update of it. So like I said, it will be available this November in print, and you guys can contact me. I'll try and put my email in the box so that you can reach out to me if you want to have copies of it and share with the women you work with. And we can provide free shipping for that as well. Okay. There's also a post-webinar survey at the end of this presentation. Once you log up, please, we'll encourage that you please complete it. Your feedback will be very much welcome. Okay.
Thank you so much for having me.
Thank you. Thank you, everyone. Thanks for joining. And do have a great rest of your day.